The IGA going back 30 years to when it was the EGA and was first established by 7 patient advocates following them attending the European Working Group on Gaucher's disease in Trieste, Italy, has always been actively involved in supporting those patients that need treatment where in the country they live treatment is just not available. We've always pledged to help any Gaucher patients that ask us for help wherever they live in the world. Therefore, advocating for charitable treatment has always been and will remain a priority for us. We live in a world where even though there are 3 licensed ERTs and 2 substrate reduction therapies available for the visceral manifestations of the disease, sadly there are still patients around the world without access to treatment, and for many they will not survive. Every week, the IGA receives requests from patients, carers, and doctors around the world asking for help to access the treatment that is just not available in the country. We are extremely proud of the work that we have done in partnership with the manufacturers of those treatments, who have charitable access programs. Each company has its own eligibility criteria, and matching patients to these programs is often very challenging, with no promises or guarantees. For some patients, the timeline once approved for treatment can be short, but for others, where there are importation challenges, or no patient has ever been treated in that country before, for example, a recent patient in Armenia, that timeline can be years, sadly. Giving free treatment through these programs is very challenging, and many hoops have to be jumped through. Once approved, the role of the IGA in partnership with the patients, the company, and the doctor is often a long one, as challenges arise and the IGA are seen as the one to turn to for help. Our relationship is often also a long one with patients and their families too, as we get sent photos of how the patients are doing and enjoy sharing milestones such as being able to go to school, or recently one of our patients having a baby. This video has been put together to share with you the work of the IGA and what it does in this area, to hear from some of those who have benefited from receiving treatment, and those that run the charitable programs, and who we work tirelessly with to support those patients that need help.
Hi, my name is Dari Soren and I come from Mongolia. I would like to talk about this incredible journey my family had throughout those years. My nephew Arunbolt has always suffered from some health issues, and Mongolian doctors diagnosed each of those symptoms. However, in 2016, his condition worsened, and we as a family started suspecting that maybe all those symptoms were connected with one underlying cause. We turned to doctors in Mongolia, but they were not able to help us. So we started researching and soon came across the website of the International Gaucher Alliance. Mm, In 2017, we traveled to St. Petersburg in Russia to attend an IGA event. And there, Arunbold was finally able to get medically tested, and he had his diagnosis confirmed. We were happy to have the diagnosis, but we also realized that Mongolia did not offer any treatment options. We turned back to the IGA for help, and after nearly 2 years of waiting, we were finally able to get help. First, Arunbold started treatment through the compassion care program from Pfizer, and then he is currently receiving treatment through Sanofi. We are immensely happy, and our prospects look so much better. We have hopes for the future. Edinburgh is getting better. We would like to thank the IGA, Tanya, and everybody who has supported us throughout this difficult journey. Thank you so much.
Hello, I am Indrasingh, patient of Gaucher disease parent from India. When my kid diagnosed with Gaucher disease, I was rounded almost 2 years and approached every possible way to save my kid's life. But no one can help as drug is not available in India. When I almost lose hope, lastly, I write a email to Tanya Madam. As per instructions of Tanya Madam, I was approached International Voucher Alliance. By meantime, International Voucher Alliance responded very well and considering my daughter's health condition and medical report, provided medication to my daughter since from long time. Now another 10 children also got pre-approval from International Voucher Alliance along with Tanya Madam. They are doing well and going to school also. We are very much grateful your precious help and we are proud to part of this community. Hope this kind help will extend until their lives. Thank you so much Tanya Madam and International Voucher Alliance.
Hello, I am Osman from Sudan, a father of two children with Gaucher disease. I would like to express my deep gratitude and appreciation to International Gaucher Alliance for their continued support. In difficult times when we had to flee Sudan because of war, International Gaucher Alliance stood by us and arranged for receiving treatment. And now, thanks to them, my children are receiving treatment in Egypt. I am very proud to be part of this community and thank you all for your efforts and continued support.
My name is Chris Hendricks and I'm based in Manchester, United Kingdom. But as you can see from the background, I'm part of a community which has been built by the IGA's help as well to represent a wide patient community in low and middle income countries. We've had some wonderful successes where the IGA has been able to help us to set up educational programs where we increase the awareness of Gaucher disease. We've been able to set up diagnostic testing programs where patients and doctors has got access to quick and easy testing, as well as then access to programs where they have access to specific treatments through the multiple charitable access programs. The IGA has been really instrumental in helping us once we have a suspected patient to make the doctors on the ground aware of potential humanitarian programs, how to access them, and then support the setup of everything that is needed to get that patient on treatment and make sure the treatment is as best as possible. Humanitarian aid suggests that it's a medical emergency, but if you have a child with Gaucher disease in a low and middle income country, this is a medical emergency and it needs a team of people to help. It needs the clinicians, it needs the patient organization, and it needs the multiple humanitarian programs. And without the AGA, we would never be able to achieve anything. So please help them expand this program and continue this fantastic work which has been done by the team. And our latest project, the Africa Roadmap, is how we've built centers of excellence with diagnostics and access to these programs to change patients' lives.
Hi, I'm Bonnie Anderson from Sanofi, where I have the privilege of leading the team responsible for Sanofi's rare humanitarian program. I'm so proud of the work that we have done together with the IGA to help patients access the treatment that they need. The IGA is often our eyes and ears on the ground, making us aware of patients in need of treatment, alerting us to issues, and really being a great partner in this journey with the Gaucher community to help as many patients as we can get access to the treatment that they need. It's been a wonderful collaboration and partnership. I would say you make us better, you challenge us, you ask the hard questions, and we're really grateful for that. There's always more that can be done, and we're continuously working together with you to understand the needs of the community, but I'm so proud of the work that we've been able to do. Congratulations and happy 30th anniversary, IGA.
Hi everybody, this is Mike Weinreich from Pfizer. I'm very excited to record this for IGA. I can say that I've been working with IGA since I think 2012 when Pfizer first got approval for its enzyme replacement therapy, teliglucerase alpha or Elelyso. During the entire time, we've been working with IGA, or EGA at the time, working with IGA in order to get medicine to the patients who need it the most and have limited access. So we've been working in a coordinated fashion with Tanya and with the entire team at IGA to identify patients who need it most and to get the medicine to them. We're very proud that we've been doing this. We're working in many, many countries, and it's all, I think, made easier for us because IGA identifies the patients. We discuss where we're physically capable of delivering the drug, and we get them the drug as they need it. It's been a fantastic partnership, and I want to say thank you to Tanya, to the entire team, but of course, I want to recognize all the good that they've been doing long before we were involved, and that I'm very proud that we were able to take even a small part in that. Thank you so much. Congratulations.
Dr. Joseph Munzer, a pediatric biochemical geneticist from the University of North Carolina at Chapel Hill. The International Gaucher Association has played a unique role in improving the lives of Gaucher patients worldwide. It takes a team to find, diagnose, and treat Gaucher patients. IGA plays an integral part in creating disease awareness, setting up local country educational events, facilitating diagnostic testing, identifying patients, and getting ERT started in patients in low and middle income countries using enzyme donated by pharmaceutical companies in charitable access programs. The international rare disease community look at the work done by the IGA as a guide for what can be done by other rare genetic support groups. IGA, keep up the great work.
I'd like to express my thanks to everyone who helped make this video, and for the patients and families for their permission to publish their photos. We should really be very proud of what we have achieved for our global community over the past 30 years. However, we must not forget that there are still many patients out there that need our help, and we must ensure that they are able to easily find us and that we are able to react quickly and be their person. Thank you.